Hi, welcome to Universal First Aid Services. My name is PJ Carroll and I'm going to take you through the steps of CPR for infants. As any person up to 1 year of age, we're going to show you one particular sequence or guideline. There are variations. We're going to just show you this one. Safety is always paramount, so when you arrive on the scene, make sure it's safe. If you've got gloves, put on your gloves. Look around for broken glass, electrics, fluid that you might slip on. Be careful if you're in somebody's home or near their home, the family pet. Dogs can be very protective, for example. Once you've deemed it safe, we then need to do an assessment on the infant. When possible, have the baby on a hard surface above the ground. If you have to do it on the floor, that's possible, but if you're going to take the baby from the buggy or the cot and place them on a hard surface, it makes it a little bit easier for you. We're going to check for response by tapping our feet, flicking our feet. It's a very sensitive area. You can make noise by clapping your hands. You can shout their name if you know their name. There's no response from the infant. I'm now going to go and check to see are they breathing. I'll do that by opening their airway using a method called head tilt chin lift. When I open the airway, I will place my ear down and I will have a little listen and feel for breath in my cheek, and I'll turn my head and I will observe here for rise and fall of the chest. Babies breathe faster than adults, so if they are breathing, I would expect to see more happening here. I will take no less than 5 seconds and no more than 10 seconds to check for breathing. Open the airway. I won't hyperextend the baby's airway. I'll go about halfway, because if you hyperextend, you could close their airway. So small working area, small little movements. Open the airway, assess breathing. 1 1000, 2 1000, 3 1000, 4 1000, 5 1000, 6 1000, 7 1000, 8 1000, 9 1000, 10. So the baby is not breathing, so I'm now going to ask somebody if there's somebody available. I will ask them to go call 999 or 112. If there's an AED available, to retrieve that and bring it back. If I'm on my own, I will take out my phone, I will dial 999 or 112, put it on speaker, place it here, and I'll allow the call taker to assist me in the resuscitation. I'm now going to commence compressions, so I can expose the chest if necessary to start compressions. I'm going to show you where we're landmarking, because I'm going to use the tips of 2 fingers on the center of the chest, on the nipple line, just on the nipple line. So if you can see here on the baby, if you imagine I drew a line between the nipples, and then I'm going to place the tips of 2 fingers right there in the center of the chest. You've got a very small working area, so you've got to be as precise as possible. The depth of compression on an infant is 4 centimeters. That's 1.5 inches in whole money. The rate of compressions is 100 to 120 per minute. That's about 2 per second. I'm going to be doing cycles of CPR here, so you will see we deliver 30 chest compressions, and then I'm going to stop and give 2 rescue breaths. When I push down on the chest, I will allow full recoil on the chest as well. So here we go, 30 chest compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 23, 24, 25, 26, 27, 28, 29, 30. I'm going to follow that with 2 rescue breaths. To deliver rescue breaths to the baby, depending on their size, I will probably have to do mouth to nose and mouth. As they develop, it may be a case of pinch the nose and do mouth to mouth, or I can do mouth to nose. Rescue breathing is a personal choice. If you've been trained and you're willing to, your call. Nobody can bully you into that, nobody can force you into that. If you're not willing to give breaths for any age group, then you should just continue on with compressions at a rate of 100 to 120 per minute. To give the rescue breaths, I would need to open the airway with my head to the chin lift. I'm going to cover the baby's nose and mouth with my mouth, and I'm going to blow in. I'm only trying to raise the chest, not their feet, so don't lose the run of yourself. The breath should be little puffs of air, just enough to raise the chest. 2 attempts at 2 breaths. Whether those breaths went in or not, I will be coming back to the chest. You don't make 4 attempts at 2 rescue breaths. You make 2 attempts. Sometimes the air goes in, sometimes the air doesn't go in. Back to the chest. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And I continue. We continue CPR when the baby recovers or you get a tap on the shoulder and help has arrived. The only good news that ever came out of infant CPR is if you were in a situation where you've been shouting for help, you've forgotten your phone, and you're going to have to leave and get help, you don't carry an adult down the stairs behind you. You'd have to leave an adult and go for help, but you should never leave the baby. So what you do is, if you turn the baby away from you, if you go up between their legs, get the back of their head in the palm of your hand, then you can pick the baby up and turn them into you. By having them in this position, you've got two options. If you're able to continue, you can be doing compressions while you're going for help. Breath can be a bit of a challenge, not impossible, but if at least you've kept the compressions going, that would be beneficial. If you just simply turn the baby in and keep the head lower than the body, that is what they call the recovery position for the infant. But as I said, the good news is I can take an infant with me. However, nobody would want to be doing CPR on an infant. But unfortunately, it happens, and it is better for me and you to know what to do than not know what to do. So that concludes our introduction to infant CPR.